Will, can you describe, for people who are not familiar with it, what duty of candour is and what was in place before Robbie's death and afterwards?
Right, well, in 1996, we identified in the High Court that there was no legal duty of candour. That meant that the doctors didn't have a legal duty in civil law to tell us the truth. We took the case to the House of Lords and the Court of Appeal, and then we ended up in Europe. And it was clarified in Europe that there was no legal duty of candour for individual doctors. We campaigned for almost 20 years to have an individual duty of candour. The government initially tried to deny that the absence existed. They were trying to say that the doctors did have a legal duty, and that legal duty would be overseen by the General Medical Council and the Nursing and Midwifery Council. But that was a professional duty, not a legal duty. But we eventually, in 2014 in November, we got the government to introduce a legal duty of candour. But that candour was not individual. That candour was for employers of doctors and nurses. And the rule was that they had to tell the truth to the parents, other bereaved families, or if there's been significant damage caused, the truth about the incident. Unfortunately, you have to rely on the doctor telling the trust. Because if the doctor fails to tell the trust, the errors have been made, which has resulted in severe damage or death, then the trust cannot tell the parents or the bereaved family what has actually gone wrong. So there's a loophole in the current duty of candour. So what we really want is a freestanding legal duty of candour for every healthcare professional, up to management level, to board level. Everybody should have a legal duty of candour. And if they had that legal duty, then people like myself, if they breached it, could actually take them to court. As it stands now, if there's a dishonest doctor, they have to be dealt with by the General Medical Council, who do not always deal with those problems. And also if it's a nurse, it could be the Nursing and Midwifery Council. But a lot of people have lost confidence in those regulators because they don't appear to make the correct doctors accountable.